Good morning, all of you. Here myself Siddharth Patel from group number LA11932. Discussion is clinical role of autonomic reflexes, viscero-visceral, viscero-dermal, and dermato-visceral reflexes. Now, let's first discuss what is an autonomic reflex. An autonomic reflexes are unconscious motor reflexes relate from the organs and glands to the CNS through visceral afferent signaling. Examples of the autonomic reflexes are digestion, blood pressure, defecation, and urination are one which can be seen in our body. There are three types of autonomic reflexes which are viscero-visceral reflex, viscero-dermal or viscerocutaneous reflex, and dermato-visceral or cutaneo-visceral reflex. Now let's first discuss about viscero-visceral reflex. It receives input from the visceral stimuli and then sends signal via afferent limb of the reflex into the spinal cord, which synapses into interneurons on spinal cord and then causes activity in a visceral organ through the sympathetic or parasympathetic efferent motor neuron. Examples of the viscero-visceral reflex are distension of gut results in increased contraction of the gut muscles. Now let's discuss about viscero-dermal reflex. It occurs when localized visceral stimuli patterns of reflex activity in segmentally related visceral organ. It operates according to the principle of interaction. Example of the viscerodermal reflexes in case of intestinal gastritis. This can be seen as a preganglionic autonomic neurons in spinal cord receive afferent activity in intestine, then postganglionic neurons in sympathetic trunk then stimulate dermal receptors resulting in dilation of blood vessels and causing red skin. Now, let's discuss about dermatovisceral reflex. It happens when localized cutaneous stimuli produces styles of reflex interest in segmentally associated visceral structure. Examples of the dermatovisceral reflexes are preganglionic autonomic neurons with inside the spinal wire can also additionally acquire afferent interest from the cutaneous thermoreceptors. Segmentally associated postganglionic fibers in belly ganglia can also additionally then inhibit intestinal movement because of pathology consisting of gastritis. Decreasing ache because of convulsive contraction are the example of dermatovisceral reflex. That's all for today. Thank you.